Hello, everyone. Welcome to the Pharmacy IR podcast. And my name is Devin Olden. And we're reporting live at the Drug Information Center. This is where we discuss unique careers in pharmacy. And today, we have a very special guest who goes by the name of Dr. Brennen Guzik. How are you doing today, Dr. Guzik?
Doing just fine. How are you doing, Devin?
Can't complain. Can't complain. Thank you for asking. So let's just get right into it, okay? Sounds good. So, first question. Who is Dr. Guzik the person, and who is Dr. Guzik the professional?
Great question. So we'll start off with Dr. Guzik, the person. So, as Devin introduced, so my name is Brennen Guzik. As a person, I will say definitely an outdoorsy kind of guy.
Okay.
I'm always up for new hikes. I'm taking on some mountain biking recently. So those are always real fun. I like to get outside. I'm actually big into photography myself.
Nice.
So coming in and kind of doing this kind of work is kind of fun to be back around all the cameras, the lights, and everything again.
Cool.
So those are some of my things. Personally, I have a lovely wife who's also a Campbell alumni as well.
Nice.
So she's a pediatric pharmacist at UNC. And then we have us and then two dogs. So we have our rescue. Her name is Nessie. She's a bundle of energy. And then we have the not bundle of energy, my older 6-year-old Basset Hound, who just is kind of a couch potato.
Gotcha.
So that's a little bit about Dr. Guzik, the person. So Dr. Guzik, the professional. So I am currently a second-year pharmacy resident, specifically in investigational drugs and research. Located at Atrium Health, Wake Forest Baptist.
Too cool. Well, can we dive more into your career in the investigational pharmacy?
Absolutely. Let's go for it.
Cool. So, what exactly do you do in this role? Because I've never heard of it, and I'm so interested in it. Please tell me more.
Oh, no, absolutely. So the joke that I always like to say colloquially in this position is I get to play with the Christmas presents before a Christmas day. So what does that mean? So I deal in the pharmacy that deals with all of the drugs before they actually get FDA approved. So we work with a lot of investigational medications that are still in our phase 1, 2, or 3 clinical trials that are being brought to market. But then additionally, too, we can work with medications that are being studied for new indications as well.
Okay, so what are your main responsibilities in this role that you're in?
So very similar to a lot of other pharmacist responsibilities. So again, the key one being dispensing, but uniquely we do a lot of patient counseling as well. So what that looks more or less like is, what is the clinical trial? What is the study that we're going to be what is the medication that we'll be using within this study? Also, too, what kind of side effects do we expect if we know at that point? What are going to be some of the labs? So again, we have clinical monitoring, we have our education, and we have our dispensing like many other pharmacists do. But the twist to it is we're working in a space instead of working, say, like with guidelines, with a lot of pharmacy specialties will be based off. We work more closely with the industry and our what we call our sponsors. And then we work closely with them and also, too, with our research teams to safely deliver investigational medication that we just don't have as much data on.
Too cool. So this is in the hospital setting, right?
Absolutely. So for us specifically, we are located in the cancer wing of our hospital.
Gotcha. So what does your day-to-day look like? Like, are you talking to nurses? Are you talking to physicians, surgeons, etc.?
Absolutely. So it depends on where I am specifically in the hospital that day. But especially like when we're starting up somebody on a new study, it's all the coordination. So I'm talking with the PI, so the principal investigator at our site. I'm working with our study nurses, working side by side with them, making sure that if it's like an IV preparation, that we're getting it administered right on time. I'll actually stay in the patient room with them a little bit while they start this, which is kind of a cool experience. Kind of talk them through what's going on. Also, to checking the labs, checking the protocol as well, making sure that we're staying and adhering to our protocol that's put forward by the study, because that's always a key thing is within our realm. If a study comes to us and they say that they want us to conduct the study, we need to be absolutely as per protocol as possible.
Do you ever have to adjust the protocol?
Generally, we will work alongside with our industry partners, and so what we'll reach out to either what we call study monitors, or we'll work with someone else that's an industry partner or somebody that is internal to that study.
Mm-hmm. So, all right, let's rewind a bit. Can we talk about your career progression, like how you got there?
Oh, absolutely.
So, from the moment you walked across the stage, hey, mom, I graduated. Where are we going?
Absolutely. So I actually took what is kind of an odd path to get to where I am now.
Okay.
So a little bit of my backstory is I actually had spent a little bit of time working for a clinical research organization prior to going to pharmacy school. So I knew a little bit about what pharmacists do in this kind of role. But I kind of put it on the back burner when I went to pharmacy school.
Mm-hmm.
And so I went through 4 years of pharmacy school, and then I actually went on to do a first year residency at a VA hospital, which was fantastic. I got to learn a lot of clinical type of things, got to work very closely and directly with patients, which I think was a great experience. But then when I heard that these type of programs were starting up, I was like, oh my goodness, this is like something that is right up my alley.
Innovative.
Yeah. And so I always like to more or less think about what are the new areas coming up? What are new exciting areas that aren't as explored? Or, I know a lot of students, will learn about a disease state in school. So like whether that be cardiology, neurology, oncology, or whatnot. And they say, oh, that's what I've got to go to.
Mm-hmm.
But for me, I always like to keep an open mind and see what else is out there. And so when I got to see something that is related to research and then also to dealing across many different areas, I was just like, well, sign me up.
Gotcha. So how much time was between the moment whenever you started this career versus whenever you graduated? Like how much time is between there?
Not a lot.
Gotcha.
Yeah. So again, this type of program is actually pretty new, and so investigational drugs is such a fast growing area at this point. I think it's continuing to develop, and it's going to continue to be one of those things. Hopefully, that more and more people start to learn a little bit more about and become more of a part of.
Gotcha.
Mm-hmm.
So, Dr. Guzik, what type of student were you, and what type of students do you think would be interested in this career?
As far as a student, like I said, I came in, I studied,
Right.
I wasn't, I will be candid, I was not a 4.0 student.
It's okay. Join the
club. But I would say, I took school seriously.
Mm-hmm.
I came in, I treated it like, especially pharmacy school, treated it almost like a job where I'd come in, study every day before class,
Mm-hmm.
Anything new, and then go in. So I would like to say that, I was an okay student.
Gotcha. And what type of students do you think would be interested in your role?
I think students that are looking for something a little bit different, like that I know a lot of students will say, and you may even experience this some in your class that say, "Oh, from day one, I'm going to be this." And and so in this role, I kind of like that you get to be a little bit of all of those, because it's just a little bit of a different space. It's just I like it because it's the type of student that would fit really well in this role is someone who is willing to explore new things, also to be comfortable, learn to be comfortable working in that gray area. I know that's kind of hard to say as a student because I'm not too far removed from you. And again, being able to just use your clinical judgment, but also to just somebody who likes to take the basic sciences and then see what that looks like and applying those directly to patient care. I think somebody that likes those kind of things, I think that they might really find investigational drugs as a cool area for them.
So, do you think students that like more routine or students that like the impractical, the non traditional role would really enjoy this?
I think honestly a little bit of both. And
Mm,
I'll tell you
talk
that.
to me.
I got you on that one. So when we do clinical trials, so again, our like golden document we're following is the study protocol. So for our students that may be like highly regimented,
Mhm.
highly routine based, again, you really need to make sure that you're detailed when reading that protocol, making sure that you're adhering to everything that is put out for that protocol. But also, too, sometimes you run into some weird things that you just would not expect. And so that's where the personality of, being able to think outside the box kind of works too.
And by weird things, are you talking like disease states? Or are you talking the protocol? Like, whoa, we're
Yeah.
not supposed to add this much, or typically we're
Yeah.
supposed to put in this type of dosage or form. You mean the
Yeah.
patient or the protocol?
Yeah. So let me explain a little bit more on this. So what happens when you have a side effect that you have no explanation for?
What do you do? What do you
Yeah,
do?
so this is where you start to think out of the box a little bit. And the protocol says normally if this happens, then do this.
Right.
But what if something else comes up? And then that's where you get to use that clinical judgment. That's when you start to, have that problem solving. And that's what I actually find very exciting.
Gotcha. Gotcha.
Yeah.
So you sound like a very diligent, not only like student, well, whenever you were a student, but also practitioner. Did you have any like mentors or anything along the way to help you establish that discipline and establish those routines?
Yeah. So I would definitely say, and especially this goes out to all the students,
Mhm.
is find those mentors, but also to have them from different areas. And it doesn't have to be necessarily like a good example is a lot of people might pick like a pediatrics pharmacist if they wanted to be like a pediatric pharmacist,
Right.
which is good, but also to have like different perspectives too. And so I like to just conversationally, talk and just learn life lessons too, and then also pharmacy life lessons I call
Yeah.
them.
Yeah.
So that's what we call like our traditionally our clinical pearls. Just again, mentorship is fantastic, especially to get into some kind of role like this.
Gotcha,
Hmm.
gotcha. And I think that's something that pharmacy could really dig a little deeper on, not even just like professors, but also students to try to go out and find mentors. I'm still conflicted within myself, and maybe you can help me with this is do
Hmm.
I look for a mentor or should I just let it naturally happen? Like have that professor that I really find interest in what they're saying. Should that be my mentor or should I go out my way and send out an email? Like what do you think? This is a
Yeah.
little off topic, but
No, I love it because this is something that again a lot of this is questions that students have
mhm,
and I'm even as I precept fourth year students I get this kind of question a lot as well is so I would say a little bit of both
okay,
and what I mean by that is especially as you move along your career, you will start to bump into a lot other pharmacists, and you start to find like personalities that you really start to jive with, and so those are good people, especially if you want to learn like pharmacy skills, maybe not in the area that you're specifically looking for. But then it's also good to have like mentors in clinical areas that either you need to feel like you need to bolster yourself or somewhere where you're trying to get to, because a lot of times those people can speak to, what path did they take to get where they are. And
gotcha,
so so I would say actually get a little bit of both.
gotcha,
Yeah.
gotcha. Because I think it's difficult as a student to figure out what you want to do
Mm-hmm.
because what do they say the world is your oyster, you know, and
Yeah.
and you're trying to figure this out. You're trying to juggle life, and you're also trying to juggle school and juggle so many different things and just figure it
Mm-hmm.
out. And especially as a P1, not to go on my soapbox, but like your
Have it.
P1 year,
Yeah.
you're trying to figure out like, okay, I think I like pharmacy. And then, after going through school, it's like, well, I thought I was good at this. And then, like, sometimes you do need that mentor to say like, no, you are qualified. No, you are smart enough. No, you are, you do have all of the prerequisites to be that thing.
Mm-hmm.
So sometimes I wish that we could speak like more on that. So speaking of mentorship,
Uh-huh.
and what do you think would be great advice? Let's say you were a mentor to all the folks who are listening. What is some great advice that you would give us moving forward for the P4s or P3s?
I always like to say be opportunistic. And what I
Mhm.
mean by that is if something unique comes across, take it.
Mm.
If something interests you or piques your interest, especially as like a fourth year student or even as a first, second, third year student on campus, you know this from sitting in this role is, go out if you have an interest in something, go learn more about it
Yeah,
or go find the people. And I think a lot of people, especially once they get into their careers, are open to talking about, what they do and additionally, how did they get there, kind of things. And so I always like to say, stay curious, stay opportunistic are two of the really big, just social skills and life skills to think about as a student.
gotcha, gotcha. And this question just hit me. Um, so how did you transition from being a student to being the professional? Because we never talk about the transition. And many times the transition is very uncomfortable. Like I'm used to showing up to class every day. I'm used to being here every day from 8 o'clock to whatever time. How did you transition, or who helped you transition?
I will say, and this may not be the case for everyone, but I think at least like a first year residency,
Mhm.
that's more or less what it is. It's a transitional period for you to become a basically full time pharmacist.
Gotcha.
And so it's funny that you mentioned that. I'll share one of my stories, and I
Please.
think all of the pharmacists out there have the same story.
Mhm.
But it's like the first time that you have your license in your hand and that first order that you're going to verify. And I can think back to mine. It was literally a potassium chloride. So just a potassium supplement. So a
Right.
40 MEQ potassium. And I'm just like, my hands shaking there. Like, am I going to click? Is this okay?
Do I
Like,
verify? Is,
I
is it
was like,
safe?
I was like, I've checked the labs 3 times
Yeah,
now,
yeah.
those kind of things. So again, but but also too, as you just gain that experience, you become more comfortable in like your knowledge set. And
Yeah,
I know that's hard to like say to a student, but I think you really start to pick up and pick up your own like rhythm and groove and whatnot once you do some.
gotcha, gotcha.
Uh-huh.
Well, here's gonna be my last question.
All
Okay,
right.
it's a good one. It's a good one.
All right.
What is next for Dr. Guzik?
Oh,
We
so
talking 5 years, 10 years? What's next for you?
what's next? So obviously, goal number one is to finish up residency.
There we
We'll put
go.
it that way. Um, and then start to establish myself at like some institution as an investigational drug
Mhm.
pharmacist. I think for me personally, I love education. I've truly enjoyed getting my teaching certificate, teaching pharmacy classes, precepting students. So if I can have that in some capacity, I think that that would be fantastic.
Nice.
Yeah.
So you can see yourself being a professor. That's what you're saying.
Maybe,
One day,
maybe. I think I probably could
I
do
think
it.
you'd be a good one.
You think so?
Very patient. Yes.
Okay.
And I'm a student that needs patience.
Oh
It's like, all
yeah.
right, you got to walk me through once or twice. But after the second, third time, I got you.
No, it's funny you mentioned that because I'm as a student
Mhm.
because it's not that long ago. As I remember being that same way,
Yeah,
and just providing like either the mentorship or meeting. I always like to say you need to meet the student where they're at.
gotcha.
So when I have like students come into the idea into the investigational drug pharmacy, I can almost guarantee you they have no experience in our realm.
Yeah.
So talking about why we do these things
Hmm.
and what's different than being a normal pharmacist, I think that those are all under, and then just kind of providing them what I like to say is something to munch on. So whether
Talk to
that
me.
yeah, so this is I like to say, what are some good resources to read? Or, what are some good videos to watch, like to get you in this space? So those are all great, great things.
Thank you, Dr. Guzik, for your time. I really do appreciate that. Thank you, sir.
Oh, Knuckles, I like it.
That was Dr. Guzik. This is Pharmacy IR Podcast. My name is Devin Olden, and we'll see you all next time. Thank you.
Thank you.